Welcome to The Source, where we combine the headlines with in-depth conversations with the newsmakers themselves. I'm Pinky Webb. Today on the program, the Health Department flags 7 cities in Metro Manila, now showing an increased trend of new COVID-19 infections. Contact tracing is now underway for partygoers, including so-called social media influencers, after violating health protocols in a Quezon City bar. What is the LGU's plan to prevent potential super spreader events? Quezon City Mayor Joy Belmonte joins us live. And later, a Duterte scenario. Davao City Mayor Sara Duterte retains the top spot in the latest Pulse Asia presidential survey, while her father, President Rodrigo Duterte, now leads the vice presidential race polls. Pulse Asia Research Director Ana Tabunda tells us more live. The health department is keeping a close watch on at least 7 cities in Metro Manila for the uptrend of COVID-19 cases in the last 2 weeks. Makati and San Juan are considered as high-risk areas, while Manila, Malabon, Mandaluyong, Muntinlupa, and Navotas are now at moderate risk. So how does Quezon City manage new COVID-19 infections, and how do they plan to crack down further on airing establishments that could become hotbeds of potential super spreader events? Let's go straight to the source of the story. We have Quezon City Mayor Joy Belmonte. Mayor Joy, welcome back to the source. Maraming salamat po sa inyong oras.
Magandang umaga, Pinky, at magandang umaga sa lahat ng nanonood at nakikinig sa ating pong programa. It's my pleasure to be here today.
It's, of course, good news right now for Quezon City, because the DOH identified 7 cities in NCR that have had an upward trend in infections the past 2 weeks, and Quezon City is not one of them. What do you think your team, and the residents of Quezon City have been doing right the past 2 weeks?
Well, first of all, Pinky, I don't want to rest on our laurels right away, because you know how things change very quickly in a matter of days, in a matter of weeks. No? But as of yesterday's report to us by Octa Research, we're in a good place at the moment, meaning our cases are down compared to even last week. Our positivity rate is at 5% lower than last week. Our daily attack rate is also lower than last week. It's up 3 out of 100,000. And our reproduction number is also less than last week. So it seems like our numbers are good, no? But then again, like I said, things can change very quickly. But what we do here in Quezon City is we do intensive contact tracing. In fact, the DOH says that there are only 2 cities that are very good in contact tracing, last that they documented, and one of them is Pasay City, and we are the other one. No? So in fact, yesterday we had a meeting, and we plan to add even more contact tracers to our roster of contact tracers, because we feel that this is really important. The use of our app is also, I believe, an important tool, because it allows us to identify where positive people have been within 24 hours, and we're able to contact trace these people right away. We do immediate granular lockdown. So even when the cases are not high, we lock down right away if we feel that this has a potential to be a high risk area. We do much more testing now than we have been doing in the past, and of course our isolation facilities have been greatly improved. So in the past, when people do not want to be isolated in a facility, now they do want to be isolated in a facility, because we provide some amenities that even in their homes they cannot avail of. So these are just some of the things that we have been doing, and it's part of our playbook already. And now I guess the challenge, Pinky, is really to be prepared for the onslaught of the Delta variant. No? So at the moment, there are none that have been identified in our city, but we are also proud to say that we are quite prepared for any eventuality that
it's nice to hear that you have a very proactive approach. I'm sure that is also the design of many Metro Manila cities, because in fact we have been through this pandemic for a year and a half already. So you mentioned playbook, you mentioned contact tracers. I just want to know, how many contact tracers do you have?
Gosh, at the moment, Pinky, and this is with the help of the national government, the Department of Labor and Employment and the DILG, we have about 3,400 contact tracers at the moment, but we're looking towards having more than 4,000, which would then give us a ratio of about 1 is to about 700 or 800, and that is actually the ideal situation as dictated by the DILG, and we're trying to meet that particular ratio.
Are you able to accomplish the ratio of one positive case to contact trace 37 individuals?
Well, this is the suggestion of Mayor Magalang of Baguio City. Although when he was interviewed, he himself admitted that they are having a hard time even accomplishing that in his own city. So here in Quezon City, as of yesterday, we are able to contact trace about 1 is to 28. And I think that's already very good. Because ideally, if people do follow health protocols, they should not really be in contact with many people. So there should not really be there should not be 37 people that they are in close contact with to begin with. No? So 1 is to 28 is, I think, already okay. And sometimes it's much less because people are not really in contact with that many people anymore now if they follow the health protocol.
I understand what you're saying there. That parang yung 1 is 37, that is the high of actually contact tracing people. So here's the thing. I do note that you are saying that it's okay, you are okay right now. Those are the operative words because things can change in a matter of days or even 1 week. Because you are good somehow right now, it's good to note that this is happening now in spite of some violations that have been seen on social media, on health protocols. Let's talk about the 2 bars that were closed down recently. In fact, before we went live, Mayor Joy was telling me hindi lang 2, 5 po ang pinasara ninyo.
Yes, Pinky, actually 5 ang nasara last week, in addition to the 2 bars that you mentioned, which were quite public, one being a bar that was frequented by influencers or social media influencers and who posted rather arrogantly the happenings in the bar, and therefore that actually gave us the evidence to close down that particular bar. We also identified 2 others that have been having parties beyond curfew hours even, and where social distancing and other health protocols were not being observed. And in addition to that, just a few days earlier, 2 KTV bars with, in fact, with GROs even were also closed down. And I'm quite concerned with that particular 2 bars that I mentioned just now, because I heard in countries close to us in Southeast Asia, a lot of the cases and outbreaks occurred in bars and also occurred when there are, let's say, interactions with women who work in these bars. No? And the problem with that is contact tracing is difficult because very few people will admit that they have been to such establishments. No? So there are challenges talaga to this.
So to clarify, Mayor, 3 po yung pinasaran yung bar, tama ho ba, at 2 KTV?
Yes. So ang ginagawa po natin, Pinky, is nagkakaroon naman ako ng roving team. Ito yung task force disciplina. They go around the city all night. And they are very, very quick on their feet. And as soon as they notice a violation, they inform our business processing and licensing department so that the very next day, we already issue a closure order. And that's what happened to all of these cases. No? Mabilis ang closure order. Pero ang para sa akin lang kasi, Pinky, kailangan talaga mag-send tayo ng message. Hindi sapat yung closure order. In fact, nakakagulat kasi some of these bars do not even have business permits. No? So kapag may closure order ka pero may business permit ka, you are going to be closed until such time that the IATF says that it is safe for you to open. You cannot just open indiscriminately. And second, if you do not have a business permit, and even if the INTF says bars are open, you cannot operate without complying with the requirements of the city. No, so that is very clear. And pangalawa, gusto namin kasuhan. In fact, kakasuhan namin yung may-ari at yung management ng mga establishments na ito, sapagkat ayon sa mga guidelines ng IATF at ng local government, sila nga ang dapat nagbabantay para siguraduhin may sapat na pagsunod sa iba't ibang mga protocols, because some of them are not just bars, they are resto bars. So syempre they can operate as restaurants, no? And
Right.
dapat hanggang dyan lang. Pero it is the objective and it is the responsibility of owners and managers to make sure that they follow these protocols, and they're very their defiance, in fact, for me, when I talk to the legal department, we have to charge them a higher against higher laws. No? And I'm thinking of the RA 11332, which is to notify about with regards to yung important health concerns, because sila dapat yung nagsasabi sa authorities, o sila dapat yung nagsasabi sa barangay, tulungan nyo kami, medyo nagiging out of hand na yung crowd dito, nalalasing na sila, etc. And yet sila pa yung pasimuno, no? And for me, the highest penalty should be imposed on them.
And so what can they be charged with? I wasn't too clear on that. Just two questions on that. What can they be charged with? You plan to charge the owners and the management, number one. Anong kaso? At number two, meron ho ba silang kailangan bayarang multa, and how much?
Well, itong, like I mentioned, itong may-ari ng mga bars at saka yung manager sa ating pong mga batas, no? And the highest law that we can apply to them is yung ubiquitous RA 11332, and I wasn't able to describe it, but now I have it with me. It's called Mandatory Reporting of Notifiable Diseases of Events of Public Health Concern Act. And the fact that there are violations going on in their very own establishments, let's say they are not able to control the crowds because there's alcoholic consumption already, they have that responsibility to call authorities to help them control these violations, and they were not able to do that. And based on the evidence that I received, sila pa nga yung pasimuno, no? Kaya yan yung i-charge natin sa mga sa mga may-ari. Doon naman sa mga customers, although this can also be applied to them, I believe that since they're just customers, and of course nabukas yung bar, sige pumunta sila, sabi ko sa legal team natin, pwede na natin i-enumerate yung iba't ibang local ordinances na nilabag nila. Kasi marami-rami naman din yun, no? And let's just give them ordinance violation receipts. At may multa yun. So, pag hindi ka sumusuot ng mask, may multa yan. Wala kang social distancing na pinapractice. You breached curfew, lumagpas ka sa curfew. Kasama rin yan. Yung mga iba't ibang batas natin pertaining to drinking alcoholic beverages, because some of them are drinking outside the bars and we're in public premises, kasama rin yan. So medyo mabigat na rin ang multa doon sa mga customers.
Mayor?
Pero doon sa owners, you asked me earlier, Pinky, ano ba yung multa? Oo, yes, go ahead, Pinky.
Sorry, puntahan ko lang po yung sinasabi yung mga tumangkilik, yung pong mga customers doon sa bar. Understandably, or resto bar, no? Understandably, sinasabi nyo kailangan may mask. But of course, in a situation like that, let's be real, they're eating and of course they're drinking. The masks will, for the most part, they won't be wearing that. What kind of, siguro ang tanong, lahat ho ba, nung nandun sa, yung nag-viral po na video, have they been identified, number one? Are they being traced, number two? And will they have to pay what? A minimum of what, Mayor Joy?
Well, yung mga caught in the act, kasi may mga bars tayo na nakaabang lang talaga yung task force disiplina. Kung hindi sila magsara on time for curfew hours and the patrons are still present, not on their way home after curfew, then pinapasukan na po ito ng task force disiplina. And obviously, the patrons there are identified, no, and are rounded up and are imposed with the ordinance violation receipts. Now, I get your point about not wearing masks, but I also I've seen restaurants practice wherein pagtapos na sila kumain at nag-uusap na lang sila, nagsusuot na sila ng mga mask, no? So hindi naman necessary the whole time you're not wearing your mask. At some point you will finish your meal, and even if you stay and linger on, you will wear your mask. That is actually the ideal practice here. Now, if they are drinking, they should drink up to a certain time only because we have curfew hours. No, yan ang kailangan natin na alalahanin dito. Now, halimbawa, just for the sake of argument, hindi talaga sila pwede mag-mask. At least, dapat sinusundan as to bar yung batas ng IATF o patakaran nila na dapat, I think, 30% Pinky, ang dapat lang na naandun sa loob establishment. And in these cases, we see them as jam-packed. No? So hindi sinusundan ang mga patakaran for social distancing. No? So that is again another charge that you can file against them. No? So pag Patron, OVR, Ordinance Violation Receipt, iba-iba yung multa dyan. Pero yung management, yan, mabigat yan. Pwede 20,000 to 50,000 ang babayaran dyan and or 1 to 6 months in jail.
Do you plan to maaari ho bang taasan yan, yung 20 to 50,000 doon sa owners and or management? Because maybe to some, masyado pong mababa yun, Mayor Joy, dahil nga kung mas mataas ang multa, siguro mas matatakot po sila at magiging mas stricto sila.
Well, at the moment, kasi since we are going to charge them with a national law, yan po talaga yung penalties na naandun sa national law. Pero yung mga ordinances din naman ng lungsod, as we would like to increase, meron din namang mga limitations as embodied in the local government code, no, that I hope at some point the congressman will amend. No? Pero at the moment, yung pinaka-maximum, yan ang kaya nating iipataw. Pero ang mahalaga, Pinky, kasi lagi dapat numuronda yung mga barangay natin, numuronda yung mga enforcers ng ating lungsod, at immediate, dapat proactive silang nag-action, no? Pag nakakita na sila ng kasalukuyang nangyayari, para caught in the act talaga, no? At wala nang kailangan pagpatunayan. Yan ang ginagawa naman natin sa lungsod natin.
I know that you need to go, Mayor Joy, but just very quickly, I wanted to ask you about your vaccination rate so far. What I last saw was that 980,000 vaccines or doses administered so far. So malapit na po kayo sa 1 million. How is the vaccination now for first dose and second dose?
Actually, Pinky, I'm very happy to announce, and you're the first person I'm announcing this to, that the Quezon City government has already reached 1 million, 14,000 doses. That was as of last night. Yan ang pinakahuli nating data. So we've reached the 1 million mark, and these are, of course, because of the second doses that we have been administering. I guess you're already familiar with the fact that we have not been receiving first doses of yet, although we have been promised first doses probably by the early part of next week, as I know some of these have already arrived. No? But in terms of the number of persons we have vaccinated, our target, as I mentioned before, is 1.7 million. That we got to this number because this represents 80% of our adult population. This number can change depending on whether the national government says that children should now be included in the targets. No, we have not included children in the targets because when the time we made the targets, wala pa namang
adults lang
para sa mga bakuna. Pero at the moment, we have vaccinated about 40% on a first dose and about 20% on a second dose here in Quezon City. At today, Pinky, ang target po ng Quezon City is 50,000 second doses po para sa ating mga mamamayan.
All right, Quezon City Mayor Joy Belmonte, ma'am, maraming salamat po sa inyong oras.
Thank you very much, Pinky, and thank you very much sa lahat po ng nanonood ng programa po natin. God bless po, Pinky.
And thank you.